Hello, my name is Heather Wilkerson. My partner is Carrie Grimes, and our presentation today is on workmen's compensation. Workmen's compensation is a mandated insurance program by the state which provides compensation to their employees. The individuals who are eligible for these funds are any employees who have suffered a job-related injury or illness, and an employee who has died in the workplace. Their families would then be eligible for these funds. In order to file a workman's compensation claim, they must submit a written claim. The employer forwards this to the state compensation office or the insurer within 24 hours to 10 days. Insured employees have the option to seek treatment with approved physician. If not from an approved physician, disability can be denied. A physician will evaluate the degree of the disability, and the physician is responsible for follow-up care. Failure to obtain follow-up care can impact the benefits of the employee. A workman compensation claim is given a claim number, and that employee's claim number is reported to the insurance company. Prior to workman compensation law, employees that had a work-related injury or death did not receive compensation from their employer. In order to get any type of workman's compensation, they had to bring the employer to court and could only sue for damages. Employees and their families were not generally successful in these lawsuits due to common law defense. Workman compensation benefits are in 4 major categories. These 4 major categories are disability income, medical care, death benefit, and rehabilitation services. 3 to 4% of the American population is on temporary disability. 1% is on permanent and total disability. How workman compensation works, it is a federally government mandated. Compensation programs are administered by the state. States are responsible to maintain insurance funds. All companies must pay into this fund, and the fund amount is based on an accident rate of the company. Due to the fund amount going up, employees can meet resistance, delaying claims, fight failed workman's comp claims, deny valid claims, delay treatment or benefits, and shuffle from doctor to doctor, causing the condition to get worse. Employers can take action to reduce claims. Ways to reduce claims is to have a safer workplace, hold management accountable for accidents, monitor claimant treatment, and ensure claimants are back to work as soon as possible. Ways to reduce high costs for employers is to offer wellness clinics, electronic monitoring of the workplace, automation of claims, have adjusters handle claimants and providers, encourage employees to report fraud, steer claimants toward more cost-effective treatment, and replace checks with debit cards. Upcoming ways that will be available to reduce costs are digital wallets, mobile devices, mobile apps used to gather the first notice of the claims, to gather the statement, document pictures, and monitor injured workers. Also, healthcare reform, which will reduce employers without insurance and decrease fraudulent cases. A brief timeline of workmen's compensation. In 1908, the U.S. Congress passed the Federal Employers' Liability Act to protect any compensate railroad worker injured on the job. In 1911, the United Society of Casualty Inspectors, founded, becomes American Society of Safety Engineers in 1914. October 13th, 1913, National Councils for the Industrial Safety established name change to National Safety Council in 1914. In 1919, National Council on Workmen's Compensation Insurance was founded and replaced by the National Council on Compensation Insurance in 1922. Also, Mississippi fact is in 1948, Mississippi became the final state to enact workmen's compensation law, so we were the last state to actually put in effect the workmen's compensation law. In December 29th of 1970, the Occupational Safety and Health Act, which is also known as OSHA, passed. March 23rd, 2010, Patient Protection and Affordable Care Act signed into a law. This is my presentation, and I hope you enjoy.